Good day, fellow learners. Once again, I'm your mentor, your fact check buddy, Ray Gapuz, joining you for another discussion of a case study. This is very significant for those of you who are taking the test within the month or in the next few weeks. And shall we keep the ball rolling? Before we begin, let me ask you to join us in this mission. Our goal is to provide free NCLEX RN application and review to 500 nurses, and to help us achieve this, just watch and finish the ads in our videos. And if you share this video to at least 10 of your friends, we'll pray for your success. Thank you for doing that in advance. Okay, so before we get to start, let me first say congratulations to Denmark Urangan Puerto, who is actually a nurse who's been out of bedside nursing for a couple of years. I think it's more than a decade, and has had the opportunity to work in the United States. And he is a graduate of Blancha College Foundation. Now, he passed the NGN for the State Board of New York last April 30, 2025. And this is his success recipe, which I would want everyone to learn from. By God's grace, I passed the NCLEX at 85 questions. The road was tough, but he never left my side. Every prayer was answered. The journey wasn't easy, but every sleepless night, practice question and review session paid off. I want to thank my family, mentors, and friends for the endless support and encouragement throughout this process. Reaching this milestone is not just a personal victory, it's the beginning of a lifelong commitment to caring for others. To anyone still preparing, stay consistent, believe in yourself, trust the RAGRS, you've got this. And that's Denmark, who is now a registered nurse in the US. And he actually paid me a visit here at my office at the Ray A. Gapuz building here in UN Avenue. And here's an example of our exchanges when he passed the test. This is what he was saying. Yung last day na TOP is our Q-bank. Okay? Bago doc yung 150 items sa functional concept, nilasap ko talaga yon kahit na gabi na ako makauwi. I stopped at 85. So he stopped at 85. He's an 85er. And that is quite a feat for someone who has been out of bedside nursing for more than a decade. And this is what he has to say about the book that helped him the most. Ang 311 Doc, binasa ko siya 3 days before the exam, cover to cover, at focus ko talaga yung mga key points. Saka yung mga sinasabi mo na lalabas to, lumabas nga. May third eye ka nga, Doc. Okay? What he's simply saying is, for those topics that I highlighted and I told them they need to study this because chances are it's going to come out, and what he's saying is that it really came out. It's not me who's saying. Okay, so let's now move on to the discussion of case number 42. And this is about peritonitis. And what a way to begin our discussion. There's no other way to start a good discussion, but it's through the use of functional concepts, which could be a word, a phrase, a sentence, or even an entire paragraph that gives your mind a sense of direction on what you need to focus on as you prepare to deconstruct NGN questions. Let's begin with the first one. Peritonitis is a serious inflammation of the peritoneum, typically caused by bacterial or fungal infection. And the common risk factors could be abdominal organ rupture, just like in ruptured appendix, perforated ulcer, or if the patient is undergoing treatments like peritoneal dialysis, or the patient could have had abdominal trauma. Now, these could all be risk factors to peritonitis, which is an infection of the peritoneum. So, what are common signs and symptoms? It commonly presents with, remember the code VD-FANS, vomiting, decreased bowel sounds, so you need to assess the bowel sounds, then fever, which signifies infection, abdominal pain and rigidity, which could be due to inflammatory reaction in the peritoneal space and or area, nausea, and of course, signs of sepsis such as tachycardia and hypotension. So I'd like you to focus your thoughts on the changes in vital signs in a client with peritonitis. So if the client is having very high temperature, so there's going to be fever, but the fever comes with elevated pulse rate and decreased blood pressure, think about peritonitis. So remember the functional concept to make things simple. Fever with tachycardia and hypotension occurs in peritonitis. The fever is due to the inflammatory process that occurs with the condition, and the tachycardia and hypotension could be associated with the development of sepsis or septic shock. Okay, so high pulse rate, low BP with high temperature may signify peritonitis. Now, what are the interventions for a client with peritonitis? Remember the code NIPS. So you have to nip it in the bud, okay? First, you have to rest the bowels so you can prepare the patient for surgery if there's a need to. So you put the patient on NPO. That's primarily to rest the bowels. Now remember, if you have problems with the gastrointestinal tract, that is always a priority. Promote rest. And how do you rest the GIT? Keep the patient NPO. And then insert your nasogastric tube if bowel obstruction is suspected or if there is ill use, meaning there's a paralysis of the gastrointestinal tract. And then immediate IV antibiotic therapy. So initially broad spectrum antibiotics will be used. And then after the culture has been done and the specific microorganism could have been identified, that's the time that more culture-specific treatments are instituted. So an example of broad-spectrum antibiotic commonly used for peritonitis is your piperacillin, tazobactam, or suzine. Okay? And then, since you kept the patient NPO, you need to correct and prevent potential dehydration and electrolyte imbalance, so you need IV fluid replacement. And since you have an inflammatory condition, you have to manage the pain with analgesics. And since this is about infection, maintain strict aseptic techniques, especially if the patient is on peritoneal dialysis. Remember, NIPS, NPO, NGT, IV antibiotic, IV fluids, pain management, and strict aseptic technique. Okay, so before we use what we've discussed to answer a case study, let's get through some of this feedback. For those of you who have used NCLEX 311, thank you very much for the very kind words. I'd like to highlight one thing. And it says here, Patok, okay, from Chin. Blank came out. I was like, Sir Ray, know what topics would come out? I'm glad I'm a Ray Gapuz baby. Okay, so you might want to join us in our next NCLEX RN QUICKFIX. And that's a reason why the world's oldest NGN passer at age 66, Flor Villarreal, passed the test through the Ray Gapuz system. And she passed it last December 2, 2024. On to our case study number 42. So we have here Maria Santos, who's age 42, was admitted just recently, actually today, May 14, 2025. The chief complaint, severe stomach pain that won't go away. The subjective findings, the patient verbalized the pain started around my belly button, meaning around the umbilical cord area, but now it hurts all over my abdomen. It gets worse when I move or try to breathe deeply. She also reported, I feel feverish, nauseated, and I haven't passed gas or had a bowel movement since yesterday. Look at the temperature. That's definitely elevated. That means the client could be having an infection. The respiratory rate is also elevated, and the heart rate is elevated. The blood pressure is low. The oxygen saturation, though, is normal, although the patient appears diaphoretic and appears acutely ill. And if you notice the abdomen, here are the findings. You have distended abdomen, board-like rigidity, generalized tenderness on palpation, and of course, the absence of bowel sounds. Assessment also reveals perforated appendix. Now, let's move on to the question. Which of the following vital signs pattern is most indicative of peritonitis? Now, the good thing about this case study is that you just have to relate the options to what were actually presented in the case. And if you still remember the functional concept we talked about a while back, we said that when there is decreased blood pressure, elevated pulse rate, and elevated temperature, then we suspect peritonitis if the patient has had any of the risk factors we have identified, like perforated organs in the abdomen, like perforated appendix, or if the patient has undergone or is undergoing peritoneal dialysis, in which case, note for the low BP first. So, well, the BP in option number 1 seems to be normal. We can eliminate. Option number 4, it's low. However, option number 3 is high normal. So between number 2 and number 4, which one could potentially be indicative of Developing septic shock, we have a BP of 90/58. That's exactly what you have in the data in the case. And the heart rate is elevated, so low BP, elevated heart rate, plus elevated temperature, that would solidify your working diagnosis that this could be associated with peritonitis. So the answer is number 2. Excellent. Okay. Now I'd like to invite you to come and visit us at our simulation laboratory at the second floor of the Ray Gapuz building here in United Nations Avenue, Manila, Philippines. We're the only one with the NGN simulators. And this is where we conduct our next gen NCLEX QUICKFIX session. And this is our main hall for our licensure exam test preparations. And we pride ourselves with the cleanest restroom you'll ever find in a test preparation center. You can't find these types of facilities anywhere in the world, I'll bet. Okay, and of course, we have students' lounge near the comfort room where the students could actually spend a few minutes talking to each other and socializing. And I'd like you to invite also your friends to please to subscribe to our YouTube channel, NCLEX Ray Gapuz. We now have more than 27,000 subscribers, and we have a promo. You get a free review from us if you process your NCLEX application with ITAPS Gapuz. And for those who are willing to join our 316 top-notchers since 1994 with 8 number 1 placers, please, okay, join us by having your NCLEX Next Gen application processing with ITAPS Gapuz, and you'll get the chance to have a free review. So with that, I'll see you in my next video. Once again, this is your mentor, your fact check buddy, Ray Gapuz, at your service. Until our next video, take care and God bless.